she's one of the bubbliest people I've ever met. She was the first doctor who ever hugged me, actually. When I asked her about the negative press related to the sling, she explained in detail about the procedure, what it was, and how it differed from what the procedures used to be. So I felt very reassured that this was the option that I wanted to try.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Luke has a question for Dr. Buzad. What is robotic surgery?
Robotic surgery is a recent platform that was introduced to the clinical world. Basically, robotic surgery is a minimally invasive platform that, when compared to laparoscopy, it shares similar features in that we inflate the belly full of carbon dioxide to create a working space. And we put ports in, small incisions through which these plastic tubes go in and retain the air inside the insufflation inside the abdomen. And so it's a minimally invasive platform, meaning we don't have to make an open incision to go into the abdominal cavity. The bottom line for me as a surgeon that is very committed to minimally invasive surgery, it's allowed me to increase my pool of patients that are eligible for minimally invasive surgery as compared to laparoscopy.
Right now, I'm standing in what will be the lobby of this hospital. From the moment you walk in, your eye will catch beautiful displays of art. Speaking of art, let's get into our next segment and take a look into the art selection process with Paul Adelson from Art Select.
Select art, So we get it all there and we get it placed and installed, and then it's like magic. Everything all comes together and it's like, wow, this is great, you know, and people are excited and they're lit up, and we get compliments, you know, the day we install it from the employees that are around, and, you know, it's a win for everybody. So, yeah, we all just keep moving forward.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and snack at the same time each day. Pain management specialists are experts at diagnosing the cause of pain and then treating it. Dr. Genaro Gutierrez is a pain management specialist here in the Austin area. Now let's meet the doctor.
I specialize in pain management, which is a division or a field within anesthesiology. What it is it's an approach towards treating pain and helping the patient manage their pain. Often pain is difficult to manage for a variety of reasons, so you have to take a multidisciplinary approach. I often tell all of my patients that pain is pretty difficult to cure, but it's very manageable. Patients with chronic pain will experience changes in their lives at home, lives at work, and even their relationships. I enjoy playing a role in making their lives better.
What's the right amount of sleep? There's all kinds of nebulous terms like circadian rhythm, and what's all that stuff mean? Well, overall, the goal for your amount of sleep is about 6 to 8 hours a night. Seems to be plenty. You'll hear rumors that, well, you're supposed to sleep less as you get older and so forth. That's not actually the case. What often happens in older folks is that there are medical reasons for you to be awakened in the middle of the night, or emotional things or whatever else. But the overall goal is still 6 to 8 hours of sleep every night consistently, with the time you go to sleep ideally about the same time every night, and the time you awaken about the same time every night, within reason. Well, the first mistake a lot of people make with sleep is that they tend to do things in bed, like watch TV, play on the iPad, which is auditory and visual stimulus, which tends to keep you awake. So when folks tell me they have a hard time sleeping, that's the first thing I'll ask them is, well, what are you doing in bed? Because the bed is meant primarily for sleep. It's not meant for electronic devices. And that one little change can actually make a big difference in your sleep pattern.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes, to classes on hemodynamics, to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because, as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. And now I'm standing in one of the operating rooms here at the hospital. If you didn't know, Forest Park operating rooms are larger than average ORs. Up next, Austin plastic surgeon Dr. Craig Hobar will be one of those physicians operating here in 2015. Now let's take a look into one of the procedures he specializes in, breast augmentation.
I decided to get a breast aug with Dr. Hobar because I was very insecure about my size and I just wanted to look natural, and he did a very good job at achieving that.
I love doing breast augmentation, and as long as it's done right, it looks very, very natural. It really doesn't look like a woman has had breast augmentation. It just looks like she's got a naturally great figure. And Lindsay came to me, and she's got a real small frame, and she wanted to look very, very natural.
His procedure, the way that he does breast augs, are different than most doctors. He doesn't go under the breast or through the nipple. He actually goes under the arm, so you don't have any scar. And it looks like a skin fold, and it disappears.
The breast augmentation can be done, the most common way it's done is an incision on the bottom of the breast. And you know, in some patients, particularly if they have a little extra breast tissue hanging over the fold, that's a fine way to go. On a very young patient, like Lindsay, and really on many patients, I prefer not putting any scar on the breast at all, and I like going through the little crease in the armpit. My bias is to do it through the armpit because it can be done exactly the same as going through the bottom of the breast or the nipple, but it doesn't leave any scar on the breast.
The recovery process is pretty easy. I was out for 2 days. I didn't do anything. It's almost been a year. All the scarring's gone down. I haven't had any problems. I am very, very happy with the results. I feel great. I love how they look.
The breast augmentation is a relatively easy surgery for the patient to recover from. There's really no restrictions on what they can do. They're going to be sore in the muscle because I really believe that the implant should be placed under the muscle. That allows the breast to look and feel more natural because it's got more natural tissue covering it. It's also important because the muscle provides some internal support. So years down the line, there's not going to be excessive stretch on the skin. It's going to be supported by the muscle.
My overall experience with coming and having surgery with Dr. Hobar was great. I feel really good now that I've had him done. I love him.
The staff over at Forest Park Medical Center has an outstanding commitment to their communities as they support health-related causes. Forest Park Austin participated in this year's Austin Runners Club, the Decker Challenge. The Decker Challenge is a 5K and half marathon consisting of a hilly route throughout the countryside. The challenge is an event for all ages dedicated to promoting physical activity. So conquer the challenge. For more information on this event, visit austinrunners.org, or for more information on Forest Park Medical Center, visit bestdocsnetwork.com. Tracy has a question for Dr. DeHaro. If my child has a fever, when is it a good time to go to the doctor?
Children with fever is a very common situation. Parents have to ask themselves if they feel that their child is significantly different than normal. Even if the fever is low, 101 for example, in a toddler. If parents feel like their child is very sick, excessively cranky, or they have other worrisome symptoms, say a long-term cough, vomiting, refusal to eat or sleep, then they need to see the doctor.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Forest Park Medical Center has a reputation of having some of the most beautiful hospital patient rooms. Some have even said that it almost feels as if they were staying in a hotel. Right now, you're taking a sneak peek into one of those patient rooms. Now let's introduce our next doctor, family physician, Dr. Paul John.
I was experiencing extremely severe shortness of breath. I couldn't walk up a flight of stairs without being totally winded. Dr. John's been my primary care physician for a good number of years, so I made an appointment and came in to see him, which led to the in-office stress test.
He was complaining to me about some mild chest pain. It wasn't really that severe, although given his age, I thought that maybe we should do some further testing on him. After explaining to him the test that I wanted to do, which was a stress test, he agreed to have the test performed, which we actually do in our office.
During the in-office stress test, there was air-dying bicycle riding, trying to go as fast as you can and maintain a certain level. At the same time, they're monitoring your lung capacity and monitoring your fatigue level.
Stress tests are pretty much a standard that we've used for a long time. The bicycle, because people were falling off the treadmills, and that was not a good thing, was to develop a protocol where we could have a very exact amount of exercise, and the techs are responsible for making sure that people exercise and pedal at a very exact rate. So everything is done in the same fashion on each patient.
One thing I really like about Dr. John, he's very honest. Be it good news or bad news, he's very honest with you, and he tells you what the risks are and what you need to do to correct whatever happens to be the problem.
About 3 or 4 minutes into the study, we noticed that he had ST changes, which is a change on his EKG that indicates a positive test, meaning that he potentially has some blockage of his arteries. I looked at the EKG, and at that point I took a picture of it with my cell phone. I sent it as a text message to my cardiology colleague, who at that point said, "We want him in the hospital right now," and we sent him over.
Dr. John got on the phone that afternoon, made me an appointment with the cardiologist, which I was able to see that afternoon, and things went very smoothly after that. I was taken very good care of. There's no doubt in my mind, Dr. John saved my life.
Stretching can help boost circulation and digestion. Remember, when stretching, to hold each position for about 25 seconds and to breathe deeply.
patient goes through the grant process, you know, me and her family were approved.
And now you've seen a sneak peek at what the current construction progress is at Forest Park Medical Center, Austin. Now, if you're still curious about this beautiful hospital or the physicians involved, please visit our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.